Certain reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all of these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the monthly finance meeting on January 15, 2019. Minutes of the monthly finance meeting on February 19, 2019. Minutes of the regular trustee meeting on January 15, 2019. And a check report January 10th, 2019 through March 9th, 2019.
I move the approval of the consent agenda.
Second. I have a motion by Dr. Brown, a second by Dr. Self to approve the consent agenda as it is prepared. Roll call vote, please.
Casper.
Yes.
Hannaford.
Yes.
Self.
Yes.
Simon. Yes. Brown.
Yes.
Ward.
Yes.
Okay, next is the CEO's report. Candace?
All right, as you can see, we were able to hire a couple of RNs recently, and then one laboratory staff member. The nursing shortage, staffing was a big topic today at finance that we spent quite a bit of time on trying to figure out how we can decrease our labor costs because agency monthly staffing so many over at the nursing home for aides and RNs at the hospital is costly, so we're trying to figure out what we can do. So working on that, as you can see, EHR test station went well. It was completed successfully. Our numbers looked really well, really good. They were 67 and we just had to be at 30 to avoid penalty. Swing bed's been busy. Looking down to nursing education, we have some sepsis training by Jeremy Williams for sepsis protocol. And Jeremy and Regina also went and talked to the retired teachers of Northwest Oklahoma recently. The Northwest Tech students are started their clinical rotations. Upfront collections, as I mentioned, was way up, which is very helpful. That was almost double what we've seen in the previous months. We had our strategic planning. For those of you that did not attend, we held that on February the 21st. And we have received that in the last couple of weeks. We'll be pulling that, and looking to fine-tune some of those things that we are doing some goal setting. So that was March. Back to January, you can see the hires back in January, most likely. Significance is kind of lost. It's a long time. I attended the medical staff retreat in Scottsdale again this year. Basically, a lot of what we focused on was, the healthcare disruptors, innovation disruptors, the Amazons of the world, trying to hit the easy button. What can we do? What are consumers looking for in healthcare today to make it fast, convenient, quality, on and on. So that's kind of where SSM is focusing. Obviously, telemedicine is at the forefront, and they are piloting right now, and I believe will soon begin rolling out. And unfortunately, Bridget was not able to make it tonight. We'll talk about it next time when she comes, but they are getting into what is it called? It's not Zip. I can't remember what their platform is, but much like some of the other hospital systems have done, where you can get on your phone basically and be seen for a certain, I think they're starting out with 14 diagnoses, and with going up to maybe 24, 28 in the end. So something new on the horizon, something we'll probably be looking at as well down the road. That's really all I have. Recruiting is going. It's off the ground. We do have one interview scheduled for April. which I'm looking forward to her coming out. It's more towards the end of April. She graduates in a year. Kevin is looking at one through a company that actually graduates in June, and so we will...
From residency?
Yeah. And he's DO program in Tulsa as well, right? I think he's doing a residency right now in Tahlequah, maybe.
Right.
So we'll take a look at him as well. Probably have another couple of interviews in May that I'm really looking forward to, excited about that. Talked to a third-year medical student last week, and we'll keep visiting with him throughout, the next few years. In fact, I offered a stipend and should hear back from him by July, first part of August, to see if he's made a decision. I think he's going to make a decision of where he wants to be after he graduates, because he's got, probably all three of us have offered him stipends, so I think he's going to decide. So we should know something pretty quickly on that one. That'll be here before we know it.
Do they still have community match? I mean, the community match with the
Physicians Manpower. Yeah, we'll be
Is that
looking
what
at
we're
those
talking
options.
about?
Yes, actually, we're looking at doing a stipend independently.
Okay.
And then we're looking at the community match, and then there's also another option as well that can go with it.
Because when I did the community match, the state match, the city's matter, the hospital's money.
Yeah. So it's going to happen, just not overnight, right? Any questions, comments on recruiting? Any ideas that you want me to chase? So I'll just say here, maybe we get the word out of kind of what's going on. Dr. Lawrence has decided to wind down his family practice and to stay working ER. So he is filling shifts in the ER. Will work 8 shifts, at least 8 shifts a month in the ER. And when he's working those 8 shifts, he's still going to see some patients. Obviously, he can't see the whole panel of patients, but he'll have X amount, I'm not going to say how many, X amount of slots a day that he's willing to see a few patients, and continue to write narcotics. That's one of the big things that we needed him to do, was continue, because the PAs and nurse practitioners cannot write for narcotics. That has to be a physician. So
Schedule 2s.
Yeah.
So
Yes, for the
Adderall,
Schedule 2s.
Ritalin,
Yes.
and the Tylenol number 3, I think all the mid-levels can write for those. Schedule 4 narcotics.
Yeah. So he'll continue to do that between him and Jennifer Nichols. Jennifer's offered to step up to the plate. Those patients have to be seen by a physician every 90 days. They get their refills every 30 days. So 30 and 60 Jennifer will see, he'll see him every 90. So that'll be part of, in that. And he said he'd be willing to add a day if he needed to, but we're just going to have to kind of play with it and see how all of that works out. But anything that we can get for primary care for him to do is going to be helpful to get us through this. If we get to the point, we decided collectively to hold off on hiring a locums at this point, a locums physician. We were going to do that initially because we needed somebody to write narcotic Schedule 2s. So we decided not to do that right now. It's $175 an hour-ish. And do people really want to come and see, are we going to get anything more out of it than the narcotic people doing the refills? Because we have volume in our mid-level schedules to still be seen, especially this time of year. It's not crazy with people having flu and sore throats and everything. So we're going to see if we can fill them up, if we can get by until we get somebody recruited. If not, we'll go ahead and hire locums to pick up that extra slack, so that we don't want people having to go outside of town for care. And if it gets to that point, it's just, we don't feel like a locums physician that they're really going to establish with a locums physician. If they're wanting to go out of town to get established, then they're probably already going to do that. So why spend the money to do
Or
that?
some of the interviews we've got coming up, how quick would they, if one of them accepted, how quick would they?
Okay, so
Possibly be-
the one would be probably more towards July or August of next year. She graduates in June, so she'd be more like August probably. The one guy that's finished in June, he'll be August this year, if that was
Okay.
going to be something that worked out. The cool thing about him, he wants to do the locums set up to kind of try us on and see if it would be something that he wants to do. So that's how the route we would go with the locums option if we decided to do that. The other couple that I'm looking at, you know, it could be by the end of the year, I think. If that will work, I really feel strongly that that could be by the end of the year. And I think it's, you know, as hard as it's been on everybody, especially on the patients, I think it's been good because it's kind of gotten us out of our box to be more flexible than the traditional model that we're used to. Meaning, if they want to work fewer days, longer days, you know, whatever, to be more flexible instead of saying, no, we need you 5 days a week, an afternoon off, something to that effect. You know, some of them are looking specifically, most of them come and say, I won't work more than 4 days a week. So, we're flexible like that. You guys have any questions? I'll quit rambling. Hang on, maybe I want to.
No, you're done.
Yes, oh yeah. It's Jay that's missing. I couldn't figure out who was gone.
Are there any other questions for Candace? If not, I'd entertain a motion.
Make a motion to approve and accept the Share Medical Center written report for March 26th.
Second.
We have a motion by Dr. Hannaford, a second by Dr. Self to approve the Share Medical Center written report for March 26, 2019. Roll call vote, please.
Hannaford.
Yes.
Self.
Yep.
Simon.
Yes.
Brown.
Yes.
Ward.
Yes.
Gaspard.
Yes. All right, next is the CFO's report. Kevin?
Okay. Well, February, we grossed $1,956,299, which is a $139,933 decrease from the prior month. Remember, there was 3 less days, so we're actually, per day, we're actually better gross revenue-wise. Our total patient days for February were 164 compared to 189 in January. And our total clinic visits was 1,714 compared to 1,440 in January. So our urgent care really seen a huge increase. When we look at the statistics, you'll see they had over 700 visits for the month of February. We had a lot of flu and all that, and that really generated a lot of business for the hospital. Our contractuals, less bad debts in charity care was 56.4% of gross patient revenue. We wrote up $193,185 to the collection agency. We also gave away $27,840 to charity care patients. Our net operating loss for February was $110,742, and our overall loss after sales tax and everything was $38,275. If you flip over to page 2, one of the reasons that our loss was a little bit larger, well, it was about the same as the month before, but it would have been a lot better if our sales tax would have held up. It went down by about $22,000 compared to the prior month. This is January compared to December, so that's kind of expected, but if it had held up, we would have probably lost, well, we would have lost $16,000. The other thing that would have also been a positive, I think I told you that we did do the interim cost report back a couple of months ago. The rate went into effect February 6th. That was an extra $300 a day. But there were 6 days that we weren't paid at the extra $300 a day. So that would have also helped our bottom line as well. But overall, the month of February was really a really good month. Otherwise, there was no other expenses that was kind of out of the ordinary as far as you look at that. Turn over to page 4, you can see that we are doing better than we were last year at this time. Last year we lost $1.1 million. This year we're at $626,000. And you know, the last 2 or 3 months we're losing about $38,000, which we're getting closer and closer to break even. So that's a positive also for the facility as well. Page 5, you can see that our cash, we still have cash. We have not had to use any of our line of credits or anything for the last few months, and we still have cash, and we're paying our bills and our vendors. We're slowly catching, climbing up that hill. It's just going to take us a while, but we're getting there. So it's slowly turning around, and we've got some other things that we're working on that will actually help improve cash flow later this year or early next year as we keep moving towards rural health clinics and some other programs that are out there as well. Page 6 is our accounts receivable. You can see that it went down some, which that's also a positive. It also helps our cash flow as well. Pages 8 and 9 is your balance sheet, and the last pages are your statistical summaries. So you can kind of see where our volumes were compared to the prior month and last year at this time. So.
Kevin, you mentioned in finance that you'd filed the interim cost report.
We did file an interim cost report. We were required to again for 7 months worth of data. I have not got back what those new rates will be, but that'll give us even a better trend now to get even more data. But that we'll continue to do that and make sure that we keep our rates at the correct amount. So if there's another increase, we'll take that bump as well, and we might get another little interim settlement or something from them if it's too low or whatever. So. That's something that we talked about. I know we did at finance. I think we might even talked here. It's something that we're going to do for the next couple of years, fairly routinely, just to make sure that we don't get either paid too much or not enough, so we can keep the cash flowing in well for the facility. We don't have to payable back. So.
Kevin, it may be in there, maybe I missed it. What's our monthly depreciation?
It is. I can't remember right off the top of my head. It was $49,593 last month.
So
right at
as long as we
50,000.
stay below 50,000,
Stay below that, yeah, we
then
should
we're
be
gonna be
good.
cash flow
Yeah, we're
positive.
cash flow positive. We've done that for the last couple of months, so. And also catch up on our cash receivable, which has also helped our cash position, so. So any other questions?
Any other questions for Kevin? If not, Kevin, thank you. Next item is Medical Staff Executive Committee. Chief of Staff, Dr. Self.
Marianne, thank you for being here. Thank you for being such a strong supporter of our hospital. And I'll just throw it out there, I'm pretty good for another 4 or 5 years.
All right, well, that's 2 more than what you told me last time.
And it's on camera.
Well, I mean, I'm 61. In July, I'll have 17 years in the Navy. And so this whole 65, 66, 20 years in the Navy, all this is kind of coming together in about 4 or 5 years. And also just for interest, last year the flu season was about a month long, and I was seeing several patients a day for like a month. And this year in my office, the flu season lasted 8 days, and I think I saw 6 patients.
You must have done a good job vaccinating them.
I don't know,
Good job.
I mean, I hadn't seen any, like I saw 2 on a Friday and 1 on a Monday and 1 on a Tuesday and 1 on a Wednesday. And
They came to see us in urgent care, I guess.
yeah, I know in the nursing homes, when we had a handful of cases, we just put everybody on Tamiflu prophylactically, and that prevented a big surge in the nursing homes. Okay, I guess I'll get down to business here. So the only thing I need to bring to the board are these appointments and reappointments to courtesy staff. And so these come as a recommendation from the medical staff unanimously. So I'll make a motion for the appointment of courtesy staff, Julie Mahaney, MD.
Second.
We have a motion by Dr. Self, a second by Ayla Simon, to appoint to courtesy staff Julie Mahaney, MD. Roll call vote, please.
Self.
Yes.
Simon.
Yes.
Brown.
Yes.
Ward.
Yes.
Gasser.
Yes.
Hannaford.
Yes.
Make a motion for the reappointment to courtesy staff of Gregory McKinnis, MD.
Second.
We have a motion by Dr. Self, a second by Hayla Simon to reappoint to courtesy staff Gregory McKinnis, MD. Roll call vote, please.
Simon? Yes. Brown?
Yes.
Ward?
Yes.
Gasper?
Yes.
Hannaford?
Yes.
Self?
Yes. And Candace, just for my information, everybody else's information, it seemed like most of these were Dr. Rader's group.
All of them are except the last one.
And shoe
Are
carts, the
all
cardiologist.
telehospitalists, yes.
Make a motion for the reappointment courtesy staff of Zahid Chima, MD.
Second.
We have a motion by Dr. Self, a second by Hayla Simon to reappoint to courtesy staff Zahid Chima, MD.
You got it.
Roll call vote, please.
Brown?
Yes.
Ward?
Yes.
Gasper?
Yes.
Hannaford?
Yes.
Self?
Yes.
Simon?
Yes.
Okay, for the record, Dr. Love is actually lab.
Okay.
He's Pat.
Make a motion for the reappointment courtesy staff of Salmon Zubair, MD.
Second.
We have a motion by Dr. Self, a second by Hayla Simon to reappoint to courtesy staff Salmon Zubair, MD. Roll call vote, please.
Ward?
Yes.
Gasper?
Yes.
Hannaford?
Yes.
Self?
Yes.
Simon?
Yes.
Brown?
Yes.
Make a motion for the reappointment to courtesy staff of Gregory Blair, MD.
Second.
We have a motion by Dr. Self, a second by Hayla Simon to reappoint to courtesy staff Gregory Blair, MD. Roll call vote, please.
Gasper?
Yes.
Hannaford?
Yes.
Self?
Yes.
Simon?
Yes.
Brown?
Yes.
Ward?
Yes.
Make a motion for the reappointment to courtesy staff of Dr. Robert Rader, MD.
Second.
We have a motion by Dr. Self, a second by Hayla Simon to reappoint to courtesy staff Robert Rader, MD. Roll call vote, please.
Hannaford?
Yes.
Self?
Yes.
Simon?
Yes.
Brown?
Yes.
Ward?
Yes.
Gasper?
Yes.
Make a motion for the reappointment to courtesy staff of Dr. Benjamin Love, MD.
Second.
We have a motion by Dr. Self, a second by Hayla Simon to reappoint to courtesy staff Benjamin Love, MD. Roll call vote, please.
Self?
Yes.
Simon?
Yes.
Brown?
Yes.
Ward?
Yes.
Gasper?
Yes.
Hannaford?
Yes.
And I make a motion for the appointment to courtesy staff of Dr. Gregory Shucard, MD.
Second.
We have a motion by Dr. Self, second by Hayla Simon to appoint to courtesy staff Gregory Shucard, MD. Roll call vote, please.
Simon?
Yes.
Brown?
Yes.
Ward?
Yes.
Gasper?
Yes.
Hannaford?
Yes.
Self?
Yes. Well, I felt like I was your point guard on that.
That was good stuff, wasn't
round,
it? Nice and smooth.
I'm through.
No, we gotta go back up to B, the approval or disapproval to change the med staff bylaws for
Okay.
ER backup call.
So I'll say my part and Candace can say her part. So we hadn't changed our policy since I moved here 32 years ago. And basically at that time, we did not have any providers at all in the emergency room. So we were all at home asleep. When somebody got sick and came in, they had to call us in, so on and so forth. So the rules were the physician had to be within 20 minutes of the hospital. And we just never changed it. And so the standard for other hospitals that have in-house emergency room providers is that the backup physician just needs to be available by phone. And so we decided to change that.
Agreed? I don't have anything to add, you said perfectly.
And, I mean, all of our providers have ATLS training and know what they're doing. I mean, when I used to do the ERs, I was fairly decent at it, but I don't ever do it anymore. And so, I mean, honestly, Emily and Hina, the mid-levels up there, they do better emergency care than I do. I'm good to bounce questions off of and help them with decision-making. So I will make a motion for the approval to the change of medical staff bylaws for ER backup call.
Second.
Is that Ward?
Yeah.
He's in the house.
I lured him in.
Stole pass.
She shamed him into it, is what I saw.
So we have a motion by Dr. Self, a second by Steve Ward to approve the change to the med staff bylaws for the ER backup call. Roll call vote, please.
Brown?
Yes.
Ward?
Yes.
Gasper?
Yes.
Hannaford?
Yes.
Self?
Yes.
Simon?
Yes.
All right, Dr. Self, thank you.
You betcha.
Number 6, Quappy. Is there anything to,
Am I doing coffee?
Maybe.
Either way, I don't care.
Oh, go ahead. I thought you usually do it.
Okay, I'll do it. We met, and we went through everything was in order. We didn't have anything that we needed to address. We continue to monitor and get prepared for our upcoming survey, which should be anytime between now and the next 3 to 4 months. So we just continue to monitor what we've been doing, so there was nothing that came out that was out of the ordinary.
and all of the, on the validation calendar, all the contracts were
We're compliant.
compliant, it looked like.
Toshiba's not because we're holding off on that, right?
Well, we did a 6-month extension,
Okay.
so it's still compliant, it's just, we just had a 6-month, 4-year one, so.
We're looking at upgrading our CT scan machine.
Okay. All right, on improvement to patient care, I guess that's the contract review.
Yeah.
Yeah. So can we just go down?
Yeah.
It's
that'd
okay,
be great.
so the first one is they decided to use different germ wipes in the facility. It went through medical staff. Now we just asked the board if it's fine for the germ wipes that we're using that's compliant. So we're just letting you know.
Survey-wise, we have to.
We have to
got
ask,
dinged
I'm
on
sorry.
it 1 year, like anything
I'll make a
cleaner.
motion
Yeah, I know, right?
I know.
to approve the germ wipes.
It's important.
Second.
I think you're safe on that.
Yeah. All right, we have a motion by Dr. Hannaford, a second by Steve Ward to approve the change or the update of the germ wipes. Roll call vote, please.
Ward,
Yes.
Casper,
Yes.
Hannaford,
Yes.
Sill,
Yes.
Simon,
Yes.
Graham.
Yes.
Might be the most significant piece of legislation.
Right?
The next
Save
one.
lives, come on, it does.
Next one is our annual infection control risk assessment. Amber completed that. There was nothing different really from the prior year, but we just have to do it once a year. Our plan for infection control.
I move to approve the annual infection control risk assessment.
Second.
We have a motion by Dr. Brown, second by Dr. Hannaford to approve the annual infection control risk assessment. Roll call vote, please.
Casper,
Yes.
Hannaford,
Yes.
Sill,
Yes.
Simon,
Yes.
Graham,
Yes.
Ward.
Yes.
The next item is the essential electric risk assessment. That's something that comes through safety. That's where we have to prove that over the course of the year that we've assessed that our generator is working properly, and we've actually had someone that comes out and looks at it, verifies everything's hooked up correctly still. And of course, we test it every month. But anyway, we have to say that we did an assessment, and we have to report for it. So just to let you know that you guys have to approve it.
I move that we approve the essential electric risk assessment.
Second.
Whoa,
Becky. Go ahead.
Hannaford's closer to me, so I heard his voice first.
Just by a smidge.
Yeah. So I have a motion by Dr. Brown, a second by Dr. Hannaford to approve the essential electric risk assessment. Roll call vote, please.
Casper,
Yes.
Hannaford,
Yes.
Sill,
Yes.
Simon,
Yes.
Graham,
Yes.
Ward.
Yes.
Okay, the next item is underneath your other tab. It's the telemetry unit. The issue we are having is the telemetry unit that we have here in the building is over 25 years old. That's one of the problems. The other problem is they no longer make parts for it. So as parts become obsolete, we might not have the telemetry unit. So we went out and solicited a bid and actually came out and had him talk with Regina and everything. So what we're looking at, if you'll look at it on that, is $132,420. But we want to set up as an operating lease since we're critical access, because that will get us the most reimbursement. So what I'm asking for is to set up an operating lease of $2,750 a month.
For 60 months.
For 60 months for a telemetry unit. And they'll get us, the stuff that we have is so old anyway that it'll actually be a lot better system. We're going to actually do some improvements in their emergency room as well. that the monitors, it'll have it actually in the rooms themselves, and they can take them with the patients as they monitor them when they go to the CAT scans in other rooms as well. So it's also a little bit of an improvement as well as far
And
as that goes.
will it not interface to our EHR?
Eventually, yes,
Yeah.
when we get to, if we get moved to the Epic system, it will be able to interface as well, so.
Does that come with any type of service?
Yeah, that's with, yeah, it's complete service, there's no maintenance fee on that, that's everything, that's a total package. So,
Make a motion for the approval of the telemetry unit that Kevin outlined.
Second.
Okay, so we have a motion by Dr. Self, a second by Dr. Hannaford to approve the telemetry unit with hospital equipment rental company on a 60-month lease for $2,750 a month. Anything else on there? Okay. Roll call vote, please.
Hannaford,
Yes.
Self,
Yep.
Simon,
Yes.
Brown,
Yes.
Ward,
Yes.
Casper.
Yes. F is tabled.
yeah. Letter G, we got a new D-dimer machine, so we need to write a policy of how to use the D-dimer, so that's what we're asking that you approve, the D-dimer policy.
I'll make a motion for the approval of the triage D-dimer policy.
We have a motion by Dr. Self, a second by Dr. Hannaford to approve the triage D-dimer policy. Roll call vote, please.
Simon,
Yes.
Brown,
Yes.
Ward,
Yes.
Casper,
Yes.
Hannaford,
Yes.
Self.
Yep.
The next item is the financial assistance policy. It's something that we need to upgrade or update every year. What it does is it gives people free care or reduced care based upon income levels. We've had to update it for the newest, latest poverty level. So that's what that's about.
Make a motion for the approval of the revised financial assistance policy.
Second.
We have a motion by Dr. Self, a second by Dr. Hannaford to approve the financial assistance policy. Roll call vote, please.
Brown,
Yes.
Ward,
Yes.
Casper,
Yes.
Hannaford,
Yes.
Self,
Yes.
Simon.
Yes.
The next item is the advanced directive policy. There was no change to that, but that's something I guess we have to approve every year, so. Just so that-
Make a motion for the approval of the unchanged advanced directive policy.
Second.
We have a motion by Dr. Self, a second by Dr. Brown to approve the advanced directive policy. Roll call vote, please.
Ward,
Yes.
Casper,
Yes.
Hannaford,
Yes.
Self,
Yes.
Simon,
Yes.
Brown.
Yes.
Okay. The next one is our disaster preparedness manual. That's something that has to be looked at every year and approved, and it went through the safety and of course quality and med staff. We're asking that, there was really no changes to it, but we're asking that you approve our disaster preparedness manual for this upcoming year.
Make a motion for the approval of the disaster preparedness manual.
Second.
We have a motion by Dr. Self, a second by Dr. Brown to approve the disaster preparedness manual. Roll call vote, please.
Casper,
Yes.
Hannaford,
Yes.
Self,
Yes.
Simon,
Yes.
Brown,
Yes.
Ward.
Yes.
And the last item is approval of our grievance policy. It's something we have to do on an annual basis. There was no changes made to the way we handle grievances, but just we have to approve it.
Make a motion to approve the grievance policy.
Second.
We have a motion by Dr. Hannaford, a second by Dr. Brown to approve the grievance policy. Roll call vote, please.
Hannaford,
Yes.
Self,
Yes.
Simon,
Yes.
Brown,
Yes.
Ward,
Yes.
Casper.
Yes. Okay. Next is the Sheriff Convalescent Home Report. Rita.
Okay, so January and February, I'll try to get these straight. For our in-service education, we had meetings on pain recognition and screening, resident abuse and neglect, and transition to nursing homes. I attended a Share Medical Center Foundation quarterly meeting. We had, in January, we had the candlelight dinner scheduled, and those nursing staff and the residents all came down with stomach flu, so we scheduled that. And we had that in February, on February 26th. Viviana is our social service director, and she made Valentine's cards for the residents for Valentine's Day. And we had, I always get it mixed up, but one of the college alumni groups came, and they are coming every month. They call it Ladies Club, and they do their fingernails, they talk about old times, different things, and they really all enjoy that. They're in a little separate room. The men want to do something, but they just keep going outside, so hopefully they can just do that. I don't know. It's working out. They are working on the garden, by the way. They are pushing pretty hard. February, our skilled census days. I'm not sure what our record is, but we were really busy for February. We had 279 skilled days. That was up from January, which was 201. Our average daily census for February was 56 compared to 60 in January. Staffing, I can just tell you, has been a struggle. We continue to seek people that want to provide good care and do that weekly on a daily basis. So we're still looking at applications. January's slow for applications because, of course, the college kids are out. People are, trying to get all kinds of things done. We have had probably about 10 applicants that we're reviewing, and hopefully that will help. I believe there was 2 positions that needed to be filled in dietary, and I believe those have been filled. Housekeeping is stable. Our fire extinguishers have been inspected. They have a biannual inspection, and there was nothing found with them. So I'm not going to combine January and February financials because I don't know if I'm fast enough to do that. But February operating cash balance for February was $94,920. This represents 8.4 days of operating expenses. Convalescent home accounts receivable balance of $664,700, increased $84,077 during the month of February. Accounts payable balance for February was $357,675. This represents 55 days of operating expenses. Our gross patient revenue for the month totaled $335,206, which was $23,472 decrease compared to the prior month. The total patient days for February were 1,600 compared to 1,891 in January. Skipping down, operating expenses were $173,105, an increase of $23,168. Convalescent home salaries and wages for February was $122,573, which was a decrease of $21,249. I'm sure agency more than doubled that, probably. The convalescent home net operating loss for February was $7,428. The net loss for February was $7,420. In January, I think we also had a loss of 4,000, somewhere in there. Yes, no, we had a profit.
Yeah,
We had a profit of 4,915. And, you know, we have a lot of really good dedicated staff. It just takes more. January and February was a struggle for several reasons. We had several residents that had been there a long time that passed. That's very hard on all staff. However, that's what we do. So I appreciate the staff that we have. They've all pitched in as much as they can and worked hard. And I think that's all I got to say. Is there any questions?
Any questions for Rita? If not, Rita, thank you. Next item is the homestead report. Kelly?
Just kind of looking at the first couple months of the year and what it looks like March is going to turn out. We haven't had bad occupancy because we're still right around that 75% range, but we're considerably less than where we were last year, same months. But last year, these first 3 months of the year were pretty incredible. January we were down about 5.5% or 9.5% compared to 2018. February we're down almost 12% compared to 2018. But our number of residents at the end of February still average of 40 paid nights or 40 paid guests or residents per night. So that's where we don't need to be I'm not really concerned about it. Our expenses are staying in line with where our revenues are, and so we're still doing pretty well in that regard. We had, just like what Rita said, we had a number of residents who have either moved on to the nursing home or passed away, and that sort of thing. So it's been kind of been tough on our staff also. And phone hadn't been ringing, but in March that has changed. So we've had several phone calls in March interested in apartments. Haven't had any move in yet, but I do think that we're going to see some more move-ins in March or in April for sure, and we'll start seeing those occupancy numbers go back up again. A lot of what we're focused on here lately has been we had some focus on making sure we did what we could to keep everybody healthy. Of course, in independent living, we can't quarantine people and tell them to stay home and all of that kind of stuff, but we do offer in-apartment deliveries. Normally that comes with a fee, but for the month of February and for the month of March, we decided that we were not going to charge residents to deliver anything to their apartment. So if they wanted a meal or if they wanted their mail picked up or anything like that, rather than have to explain to somebody that doesn't understand anything about medical diagnoses or anything like that what their problems are, we just waive all those fees for the month of March or February and March, and we ask our residents to voluntarily report if they have been given a diagnosis of the flu, because that helps us decide whether or not we want to continue to have activities and things of that nature. But I don't think we had a single resident with the flu this year, and I think our staff stayed pretty healthy as well. We did have some staff out for illness, but nothing major, just some minor things here and there. But we stayed on top of that as best as we could in communication with our residents and whatnot. We're getting into March is our 9th month for having our expanded services that we started offering this fiscal year, and we've had an increase in participation again this month, and so it continues to be something that I'm glad we were able to start providing for our residents, and they're using it more frequently each month. So that's good. Projects, we have a couple projects, pretty big size projects going on right now. One is with the grant we received from Share Trust for our super 2-bedroom conversion with the adaptive upgrades, I guess you'd say assistive devices upgrades. We have the company on site this week, finally, installing the ceiling electronic lift and track system, and that's going to be pretty cool. It's got a track that mounts into the ceiling, and it's secured up there. It'll hold 500 pounds, and it'll run, people from the bed to the commode to the bathtub without having to perform a transfer. So it's going to be great for those married couples that can take care of each other if they just had the right equipment. So this project has gone on way longer than I thought it would, but we've had to rely on out-of-town contractors for some of the more technical aspects of this, so we've kind of been at their mercy. But that said, hopefully when we report in April, it's finished, and we'll be moving somebody in soon, because I do have a reservation on that apartment, and they're chomping at the bit. I wish I could get them in there. The other big project that we just started this week was Bo, I don't want to steal your thunder, but City Council approved purchase of, it had been budgeted.
Saves me time.
And for a new walk-in cooler and freezer. We don't have a walk-in cooler or freezer. We have, stand-up, they're commercial units, but we have one refrigerator and 2 freezers. And oftentimes we're storing food over at the nursing home still, just in order to have a place to put all our food. So they started yesterday with digging out the dirt to pour concrete and moving some HVAC units and that sort of thing. And we've got looks like a 6 to 8 week project period, weather, cooperating, to have the walk-ins installed and operational. It should more than double our refrigeration and freezer space. It will also increase our dry storage space, because we'll take the commercial units out of the kitchen and surplus those. And
So you're going to sell those?
The city will sell those, yes. They'll do I think we're going to probably do a sealed bid process on the freezer, 2 freezers and 1 cooler. So those will be available. The yard is going to start to be an issue before long, and we've got the spraying done. The maintenance crew's got the spraying done today, I think that's the most of that. On the financials, as far as January is concerned, we had a $77,182 gross revenue, and that was pretty consistent, a little bit up from where we were in November and December. In February, we dropped down quite a bit, about 13 grand. A lot of that is timing with our Woods County Jail payment for the Meals on Wheels. But in February, our revenue was $64,842. Our expenses in January were $15,881. In February was $14,104. And our net income for January was $15,881. And in February, I'm sorry, I stated that wrong. Our expenses were really low, weren't they?
Yeah, I knew what you were saying.
Our expenses in January were $61,301. In February, they were $50,738. And then I told you what our net income was. That was our net income and not our expenses the first time around. So we're still in the black, and our our monthly numbers. And then year-to-date, we're up quite a bit. Well, we're up about $26,000 in revenue. We're down about $38,000 in expenses. And we are at a net income on the year of $157,127, which is about $65,000 up over last year. So I'm happy to answer any questions.
Any questions for Kelly? If not, thank you. Do you have a foundation report?
Well, and I should have had more. I forgot we didn't do this last month. You guys all have in front of you an invitation. Most of you, I think, probably got yours in the mail to our donor and volunteer appreciation dinner. So I ask all of you to let me know if you can make it. We'd love to have you. And if you bring in a guest, let me know that too.
Rosemary, would you be sure, make sure that you post a non-business agenda in case all the board members want to come? We don't have a quorum issue.
Because we would love to have all of you.
And not kick somebody out. Which has happened before. Yeah, I just didn't call you one night.
I think the invitations probably hit mailboxes around the weekend, and we've already had 29 people RSVP, so we may have good attendance. We may have to look at a venue change. I'm not looking forward to that, but if we have to, we have to. So we send out about 800 invitations because we invite everybody that's ever given to our foundation or ever volunteered with our medical center. And so we always get some back where we find out we don't have good addresses anymore. But, that helps us too. So, normally we expect around 60 to 70 people. So we'll see where we get with this, and we may have to have a venue change, but I'm hoping not. I hope it's kind of a double-edged sword. I'd love to have more people. The venue options in town get a little bit more challenging after a certain number of people. So the foundation board did meet in January, like Rita said, and we did have some of our normal first of the calendar year activities. We approved our transfer to our endowment funds according to our investment policy. So our funds at the Communities Foundation continue to grow. Our net worth as a foundation, if you will, continues to increase. And we had probably one of the best fourth quarter and even first two quarters of giving in 2018 than we've had since we did our major EHR campaign back in 2012 and 2013. This has been the best first 6 months of the year for the foundation since then. And we're, I'm not going to give you a number because I'm not remembering, but giving has been good, even in a year where, wheat harvest wasn't that great. Cow prices kind of stink. Oil and gas have been what oil and gas has been. And we still have had a very good first half of the year for the foundation, and looking forward to what we're going to be able to do to finish out the year.
All right. Any questions for Kelly? If not, Kelly, thank you. Is there anything from St. Anthony's to report? City Council reports?
The only thing to add, we also purchased a fire rescue truck, and we changed or amended one of our ordinances that allows a rec park now to meet quarterly instead of monthly. And we tabled some dilapidated buildings that we'll cover next meeting. Other than that, it's pretty short meeting.
I noticed they started working on streets.
Yep.
This last week.
And after some comments, we might end up changing some of the streets we work on that we had at the meeting, so we'll see.
We love the city council. We think they're doing a wonderful job.
Thank you for all you do.
All right. One item, May 28th, or so our May meeting is scheduled for May 21st, but Candace needs to be gone. Kevin thinks he needs to go on a cruise or something, and so.
Did you hit the lottery again?
It's him this time.
It's my
not me.
wife. It's never me.
And so we need to move that from May 21st to May 28th. Okay?
Yeah.
The only other thing I'll close with is in the passing of Lynn, I first want to tell the Martin family thank you for all the years of coverage that you guys have provided for the hospital. You've always been fair and balanced, I guess, and many times I know Lynn would call and say, hey, what can you tell me on this? There's one in particular that comes to my mind as I was on a ball field getting ready to play a ball game, and he calls me up and he says, hey, do you have a moment? I said, not really, we're getting ready to play a ball game. Well, just take a minute. And anyways, I think I started coaching at third base and I'm still on the phone, giving him something that he can put into the paper. But we want to say thank you, and you're in our thoughts and our prayers, and will continue to be in our thoughts and prayers as the weeks and months and years go by. Thank you very much.
Yes, thank you.
With that, we are adjourned.